Hello everybody, welcome to BD Nurse e-corner channel. So I know you are all excited to know what is the topic we are going to discuss today. As before going to the topic, I would like to give a small clue on it. So this is a procedure which is being done by all the first year, second year, third year and even in the final year. The students are able to do this procedure, and this procedure is being done whether it is in a OPD or might be in a inpatient or might be in a community or society. So this procedure is mainly mandatory to know for each and every one of us, because this plays a major legal and liable issues while doing the procedure. Yes, today we are going to see on, can you guess the topic we're giving all these queries?
Oral drug administration.
Yes, very good. So today we are going to see about oral drug administration. So we have quite a lot of methods of drug administration, but in that we have taken a small subset, that is oral drug administration. So in this we will be having a tray containing hot water, which is mostly edible, and if the patient is having any sort of infections, it's better you use a lukewarm water. This is like for administering the drug. For easy swallowing of that particular drug, we will be using water. And then you will be having mortar and pestle. This is not mandatory for all the patients. This is mandatory for a patient who is unable to swallow the drug or might be in an NG tube. So to powder the drug, we are using this mortar and pestle, which is used for geriatrics, pediatrics and patients with NG tube, nasogastric tube. And then you have a bowl, the drug which is contained in, and if you are opening the drug, it should be in a sterile container. You are not touching the inside of the container. As this is fully sealed, the drug is directly being given into the patient's mouth, so we have kept in a bowl. Then you have sanitizer to wash your hands before doing the procedure, and then to receive the waste you have kidney tray and paper bag, and then to give the drug, we can convert the water into the tumbler, and if in case it is in a syrup form or might be in suspension forms, you'll need to have a ounce glass or maybe a measuring cup. Followed by that, you need to have a towel. The towel is mainly to just protect the patient just from getting wet, and also after consuming the drug, we can use this as for wiping the mouth, right? And then of course, one important thing is that the patient card, medication card, followed by that all the articles which is need for your documentation. So what to start on with the oral drug administration? Well, children, do you have any queries in this?
What is meant by oral drug administration?
That's a good question.
Yes,
Anybody can answer this?
I will explain. It is a route of administration where the substance is taken by the mouth, swallowed and processed via the digestive system. And it is a common method used in many medications, and also it is a slower process.
Yes, as Manya said, this is a slower process in the sense it goes to the liver and get metabolized by the time when compared to IV or might be an IM administration. Might be this is taking around 1.5 to 2 hours after the drug administration. We have to do the reassessment whether the drug has been acting on the patient. Any other doubts you have?
What are the oral drug administration?
Okay.
Yeah, I'll explain. Buccal, sublabial, sublingual administration. Medication comes in various forms: in oral solid dosage, tablets, capsules and powders, oral liquid dosage, teas, drops and syrups.
There are quite a lot of number of new generations. By even nowadays, you have the paracetamol in the form of ice creams. Where the pediatric patients are easily taking the drug. Thereby, it is not making the patient to get vulnerable. They are enjoying the drug meanwhile as the new generations of drugs are into existence. Do you have any other doubts?
Ma'am, what are the advantages of oral drug administration?
Yeah, that's a good question.
Yes, ma'am. Easy to administer, non-invasive, available in various forms, less expensive and totally stable.
So, yes, as you said, it is available in various forms, in the sort of like capsule, syrups, you have oral suspensions, you have powdered forms, and you have direct IV tonic forms and so on. So you have that great advantage as well as it is non-invasive. It is not going to create pain into the patient. So patient is now going to enjoy your procedure rather than going to have anxiety or fear when compared to IM or IV.
What are the disadvantages of oral drug administration?
Can anybody answer this?
Yes, ma'am.
Yeah.
The absorption of medication can be affected by various factors. Oral medication can cause gastrointestinal issues. Drugs can taken orally pass through the liver before entering synthetic circulation.
So yes, there will be more majorly as it is dealt with GI. So there will be major side effects such as GI absence or GI might be patient may have nausea or vomiting or might be diarrheated. So that is one quite challenging factor. So with that concern, we will be planning for either oral or might be other forms of drug administration. Any other queries? You're done with it. So yes, like how do you do the procedure? Is it like the same procedure like the other procedures? Of course not. So always you have certain standard operating procedures to avoid the sentinel events or might be near miss events. So what are these sentinel or near miss events is that we are finding out whether the right patient is given the right drug and the right dosage, and followed by that whether we are giving in the right route. For example, my patient is Mr. Pananisami, age 64 years, and he has been advised with paracetamol. So before I could go and start on with the drug blindly, so first what we have to do is that we have to check the patient's label. So what you are going to check the patient's label? Maybe you check the patient name with both Pananisami and the IP number or the OP number, and then if the patient is very much conscious, you can ask him. If the patient is unconscious, then you can ask the agenda. Can you tell me your person who's lying by and the relationship with you? Yeah, then they will be answering. It is Pananisami, and maybe it is his father or maybe brother or cousin or something. So you have to confirm if the patient is conscious to the patient itself by the patient label, as well as if the patient is unconscious, then ask the patient admin. Then after the confirmation is done, then you are checking whether it is the right drug. So you have to confirm, okay, paracetamol 650, so here also paracetamol 650. And check the expiry date of the drug, because you cannot give an expired drug to the patient. Then after that, you are going to check it whether you are going to go with oral drug. So oral drug, the patient is able to swallow by just talking to him. We will know that the patient is conscious and there is no GI upsets or GI problems such as any esophageal cancer or oral cancer. For those patients, we cannot administer orally. So you are checking whether there is any facial tumors, neck tumors, nothing is there, good reflex, conscious, then definitely you can give it through oral. Then the next one which we think take important issue is that the right time. For example, if this paracetamol is administered twice a day, then that should be given 8 a.m. in the morning, then 8 a.m. in the morning. So you are just documenting the right time. Then might be I prepared all the drug and I am going near the patient. Mr. Pananisami, can you please have your drug? Might be he says, no sister, I don't want the drug. Then that is also an equal right. You have to accept it. You cannot refuse it. So the patient can refuse the drug. The only thing, immediately go to the nurse's station and document that Mr. Pananisami refused to take the drug 8 a.m. Maybe little later he wants the drug. He may say, I am feeling nauseated, I will have little later 1 hour or 2 hours. Document that. Then whenever you give the drug, you explain the drug that I am going to give this paracetamol. This is actually aiding for your pain relief. If the patient is having pain, then you tell it as pain relief. Because paracetamol is having more than one action, such as it is having anti-inflammatory, it reduces the swelling, analgesic, it reduces the pain, as well as the other one is that antipyretic, it reduces the fever. So you have to give the exact teaching. If it is for fever you have administered, tell him that this drug will reduce the temperature. Then he may ask, he is also having the equal rights. He may ask the questions and doubts further. Might be, is it having any side effects? Then we have to say yes. If you are going to have more than 1 gram per day, this is only 650. If you are going to have more than 1 gram per day for more than 1 week, that may injure your liver. So that you will be keeping into concern. And then finally, you would give some advices when the patient goes. That is right advice. So that is the last right of drug administration. You give the right advices, like when this drug to be given. For example, if you are giving any beta blockers, he or she have to check the pulse. I believe the attendants can be taught on how to check the pulse, and if the pulse is less than 60, then that drug cannot be given immediately on the particular time. Might be 1 hour or 2 hours later, they can give the drug, right? So far we have discussed of what is an oral drug administration. Are you now clear about it? So will you be able to do very confidently to your patient when you are doing the drug administration?
Yes, ma'am.
Okay. That's all for today. Thank you, and don't forget to like, subscribe and comment on my channel.